A healthy life is the synonym for a happy life. So do not wait until tomorrow if you can begin today. Good evening, dear viewers. Welcome to BMC Global Live Al Hilal Health World, an exclusive health talk with doctors from Al Hilal Hospital. Today, our topic for discussion in this 49th episode of Health World is gout. So moving ahead, we shall definitely see what is gout, its causes, symptoms, and how to go about treating it. And I'm happy to welcome the doctor joining with us today, Dr. Imit Kodungukaran, a specialist orthopedic surgeon with over 7 years experience. He completed MBBS from Pushpagiri Medical College and post-graduation from Kottayam Medical College. Currently working at Al Hilal Hospital, Salmabad branch. Good evening, doctor.
Good evening.
Welcome to Health World episode.
Thank you.
Thank you for joining with us once again. Doctor, so the topic we have chosen today is gout.
Yeah.
So let us start with what is gout.
Gout is a type of inflammatory arthritis. That means inflammation of the joints caused by high level of uric acid in your body.
Okay.
This high level of uric acid in the body is known as hyperuricemia.
Okay.
Hyper means high and uricemia means in the blood uric acid.
Okay.
So, but hyperuricemia and gout are not the same,
Okay.
because hyperuricemia can present in many ways.
Okay.
For example, in many cases, hyperuricemia may not produce any symptoms at all. Like they don't present with pain or anything.
Okay.
And we detect hyperuricemia in these kind of patients during routine checkups.
Okay.
This kind of presentation is known as asymptomatic hyperuricemia. Asymptomatic means without any symptoms.
Okay.
And but still, the gout is the most common clinical presentation of hyperuricemia or high uric acid in the body.
Okay.
And other clinical manifestations of high uric acid include uric acid kidney stones, and in rare cases a condition called TOFI.
Okay.
TOFI is basically when you have very long time or prolonged hyperuricemia, uric acid will deposit in and around joints and in many soft tissues, which causes swellings over the skin. So this will be visible as swellings over the skin.
Okay.
This is called TOFI. So hyperuricemia or high uric acid can present without any symptoms and will present as gout and sometimes present as renal stones, and very rarely the presentation can be TOFI also.
Okay.
So the point I want to emphasize is that high uric acid may not always lead on to development of gout.
Okay. So doctor, you said high uric acid can lead to the presentation of gout.
Yes.
Are there any other causes for gout, or how does it present as gout?
See, gout is essentially caused by high uric acid in our body,
Okay.
but in a susceptible group of patients only. And uric acid, actually uric acid is it's a normal content in the blood.
Okay.
It is a powerful antioxidant, and a normal quantity of uric acid is synthesized inside our body, mainly inside liver and intestine,
Okay.
from another molecule known as purines.
Okay.
This purines comes into in our body from two major sources. One from externally from the food that we are taking, and the other source is our body itself.
Okay.
Because purines are structural component of genetic material in our cells known as DNA.
Okay.
So when a cell dies or when a cell become damaged, that is happening in our body regularly because our cells, as we call cell cycle, constantly are dying and new cells are coming. So in this time, the purines will be released.
Okay.
So in our body, purines come from food that we are taking, and also from the body that is synthesizing at a normal quantity.
Okay.
And inside body, the purine will undergo metabolism. The metabolic end product of purine metabolism in humans is uric acid.
Okay.
And a particular quantity of uric acid will be cleared mainly through the kidneys every day. So this is happening in a normal person.
Okay.
Uric acid is being synthesized, and a constant amount of uric acid will be cleared through the kidneys also. But in case of patients with gout, what is happening is because of some genetic problems, some group of gout patients synthesize more uric acid in their body. This group we call it as overproducers.
Okay.
And in another group of patients, problem will be there in the clearance of uric acid from the kidneys.
Okay.
It can be because of some developmental problem, usually genetically mediated, clearing mechanism of the uric acid, or it could be because of some kidney damages because of some kidney diseases, or it can be because of intake of some kind of medications that can interfere with the uric acid clearance. For example, some anti-cancer medication, some anti-hypertensive medication can interfere with the uric acid excretion through the kidneys.
Okay.
So these group we call as under excretors. Okay. So in some group overproduction and some group under excretion. This is the cause for higher uric acid in some types of patients. Some patients that lead on to development of gout. The problem with the higher uric acid in the body, uric acid is not readily soluble in the blood. So after a cutoff, the uric acid will start precipitating and form needle shaped crystals.
Okay.
We call these crystals as monosodium urate crystals.
Okay.
So once the level of uric acid become high, there will be precipitation in many areas. If it precipitate and condense in our joints, it will provoke a gout attack, and if it deposit in kidneys, it can cause kidney stones.
Okay.
And prolonged or long-standing deposition in many tissues can cause swellings that can be seen outside as swellings over the skin, which is called tophy.
Okay.
So from this, what you have to understand is that gout is not entirely because of intake of some kind of foods, but in some patients are more susceptible, genetically susceptible to retain more uric acid.
Okay.
Can be because of sometimes because of overproduction or sometimes because of under excretion. And if these patients, if they take more of some food items that can induce gout, they will end up in gout attacks.
Yes. So doctor, what could be such food items that can increase or cause gout more?
Okay, certain non-vegetarian foods that are rich in purine, like example red meat. Red meat, what I mean is that beef, lamb, pork, and organ meats also. Organ meats means brain, liver and all. These all are high in purine.
Okay.
Then some kind of seafoods like shrimps, lobster, crab, and herring, trout, then sardine, tuna. These all contains more uric acid, and it can provoke a gout attack. Okay. Another food item that can induce gout attack is alcohol. Okay. Most of the alcoholic beverages, except beer, doesn't contain higher level of purines, but still they can induce gout attacks, because when you take alcohol, our body try to expel more alcohol in spite of uric acid. Okay. So that will indirectly increase the uric acid level. So this way alcohol can induce a gout attack.
Okay.
Another food item that can induce gout attack is high fructose food items and beverages, like sweetened colas, pastries, cakes, ice creams and all. Because high fructose, if you take high fructose, the excess fructose will be converted into uric acid inside our body. Okay. So these are the food items normally have to be avoided by your gout patients.
Okay. Doctor, so you spoke about the food items that can cause gout. So what could be some food items that are safe for gout patients?
Yeah, this is a relevant question, because a patient need to know what are the food items he can take safely also.
Yes.
So this include most of the staple foods like rice, maize, wheat, barley. Everything is safe for gout patients. Then for non-vegetarians, chicken, egg are safe. Okay. Then low-fat dairy products are safe. Okay. And regarding vegetables, although some of the vegetables like asparagus, spinach, mushrooms contain high purine, but still most of the studies shows that these vegetables cannot produce hyperuricemia or gout. Okay. So nowadays it is considered that most of the studies considers that almost all vegetables are safe for gout patients. Okay. And also some of the studies shows that some food items can reduce the uric acid level in the blood also. These food items include vitamin C rich foods, cherries,
Okay.
then coffee, etc.
Okay. So, doctor, who are at high risk of getting gout, or are there any risk factors that can trigger this disease?
Yeah. The major important risk factor to develop gout is gender,
Okay.
because males are up to 4 times more likely to get gout than females.
Okay.
In females of reproductive age group, estrogen in them have a protective role against gout. That's why after menopause or stopping periods in females, the risk of developing gout will be equal in both genders.
Okay.
Another risk factor to develop gout is age. As the age advances, chance of getting gout also more. That's why older age people are at risk. Then next risk factor is obesity. Obesity is a risk factor to develop gout, and is also noticed that obese individuals tend to develop gout at an early age also.
Okay.
And genetics also play a role, because there are some genes that can regulate uric acid metabolism in kidney and intestine, and that can regulate the chances of getting gout also. That's why gout can run in family. And some comorbid conditions like hypertension, thyroid abnormalities, all are risk factors to develop gout.
Okay. Definitely, we have only dealt with the basic aspects, what is gout and what can cause, what can trigger, what are the risk factors of gout. We have to know how we can go about treating this. Definitely, we'll be coming back after a very short break, so stay tuned. Welcome back. You're watching BMC Global Live Al Hilal Health World. Nothing but lifestyle. Our topic for discussion in today's episode is gout. So let us move ahead with the further queries. Doctor, what are the symptoms that gout patients present with?
Typical gout usually presents as brief attacks of pain and inflammation of the joints.
Okay.
We call these attacks as gout attacks.
Okay.
So normally gout attack starts during the night time when the patient is sleeping, and mostly only one joint is affected.
Okay.
And the most common joint affected is the joint between the big toe and the rest of the foot. We call this joint as first metatarsophalangeal joint.
Okay.
In more than 50% of the cases, this is the joint affected.
Mm-hmm.
And other joints that can be affected during gout attack include joints of foot, ankle, knees, then joints of wrist, hand and elbows. Because uric acid have a tendency to precipitate in colder joints.
Okay.
Colder joint means joints that are away from the heart. So that's why uric acid or gout attacks are less common in shoulder, hip joint and joints of the trunk.
Okay.
And once pain starts in one joint, within few hours pain, swelling, redness, warmth, everything will peak at, it will reach its peak.
Okay.
and this pain, everything will continue there for around 3 to 10 days time. After that, the pain will reduce.
Okay.
Even if he doesn't control uric acid, the pain, the acute attack will reduce. Then if the patient doesn't, patient not control his uric acid level, what happens is he will get repeated attacks.
Okay.
So when will be the next attack, we cannot predict, because some patients get next attack within few weeks, but in some cases it will take around 1 or 2 years also.
Okay.
And the interval between the attacks will be pain free. So the interval between the attack is pain free even if the uric acid level in the blood is high. So this is an important point, because you cannot predict the level of uric acid in the blood according to your pain intensity. So even if you don't control your uric acid, you will be pain free after the one attack, and most of the patients think that their uric acid already is reduced and they are okay. And mostly they will end up in next attack.
Doctor, so once a patient presents with such symptoms, how do we go about with treating gout?
Usually a patient present to doctor during the gout attack.
Okay.
So he presents with pain, swelling of the joints. So our first priority is to reduce his pain and swelling and his disability.
Okay.
So for that, we usually start him on anti-inflammatory medications, injections. Sometimes we start on steroids as tablets, or sometimes we give injection of steroids to the joint affected. And we advise the patient to elevate the affected part, apply ice and get some rest and all. So this is the treatment of acute inflammation of gout. Okay. And the next aim of our treatment is to reduce level of uric acid in its blood so as to prevent future attacks. So for this, we have some medications, and medications act by two ways. Some types of medicines reduce the synthesis of uric acid, and some types of medicines increase the excretion of uric acid through the kidneys. And these medicines are maintenance medicines. The patient has to continue these medicines for long time, like it will take around months or years to clear all the uric acid crystals that has been deposited in the kidney, in the tissues.
Okay.
So these medicines are maintenance medicines. Apart from medicines, we tell the patient to follow a strict diet plan, to avoid all the food items that we already discussed, and to include more of vegetables and fruits in his diet. And we tell the patient to ensure good hydration, and also to reduce obesity. Regular exercise is important, and to control his all comorbid conditions like hypertension, thyroid disorders that can lead on to development of gout. So this is a nutshell of treatment of gout patients.
So doctor, are there any complications if gout is left untreated?
Yeah, definitely. Gout has many complications. If a patient has repeated attacks of gout in single joint, that can cause permanent damage to the joint. And prolonged uric acid deposition in kidney can cause kidney damage and kidney failure also. And even gout or uric acid crystals can deposit in your heart walls also. And hyperuricemia nowadays is considered as a independent risk factors to develop other complications like metabolic syndrome, diabetes, hypertension, atherosclerosis, cardiovascular complications and all. So controlling uric acid in a gout patient is not only to prevent gout attacks, but also to prevent these kind of complications.
So doctor, what could be your advice to the viewers watching us now?
Okay, before that, I would like to debunk some of the myths about gout. The first one is that you can stop uric acid lowering medications once your uric acid level in the blood become normal. This is a misinformation, because we are giving medicine to reduce the uric acid level in the blood only. So it will take like months or years to clear all the precipitated uric acid crystals that's been deposited in the tissues over few years. That's why you cannot just immediately stop uric acid lowering medication once your blood level reaches normal. Another myth about uric acid is that high uric acid will always cause us pain. This we already discussed, because in case of asymptomatic hyperuricemia, and in case of gout attacks also, between the attacks the interval is pain free.
Okay.
So you cannot predict the level of uric acid in the blood by assessing your pain score.
Yes.
Another myth about uric acid is that uric acid causes generalized body pain. This is also a misconception because uric acid normally presents as acute attacks, normally in single joint. It will not cause generalized body pains.
Oh, okay.
And my sincere advice is to patients with gout, you should stick on to the treatment as advised by the doctor.
Yes.
You should check your uric acid level at least in every 3 months or advised by the doctor, and do not change or do not stop medication by your own. And it is okay or it is normal that during the starting of the treatment some people get flare up of gout attacks. There are a lot of reasons for that. It doesn't mean that your treatment is not working or you have to change the medication or anything like that. You stick on to your treatment. After a few months, once your body level of uric acid reduces, you will be pain free.
Okay.
And along with the medication, continue your diet control, good hydration, and control your obesity. Exercise is important, and control your all other comorbid conditions as well.
Okay. Doctor, are there any facilities specifically available at Al Hilal Hospital for patients with arthritis or such related diseases?
Okay. I'm working in Al Hilal Medical Center, Salmabad branch.
Okay.
It's a multi-specialty medical center. And in orthopedic department, we have all the modern diagnostic facilities like modern laboratory, CT scanning, ultrasound scanning, and digital X-ray with the PAC system and all.
Okay.
And for the treatment of arthritis, apart from medical treatment, we have all the advanced injection treatments.
Okay.
Like you must have heard of PRP injection, like it is platelet-rich plasma injection. This is a well-known modality for treatment of arthritis, tendinitis, plantar fasciitis, tennis elbows and all.
Yes.
Basically, in this treatment, what we are doing is we are taking patients on blood, we are centrifuging, and we are taking a small portion of the plasma that is rich in platelets, and we are injecting that plasma to the site of inflammation. This will induce healing and thereby reducing inflammation. This is a well-known treatment method. And another kind of injection available is hyaluronic acid injection. Hyaluronic acid is nothing but it's a substitute of normal synovial fluid in the joints. You all may be knowing that in case of osteoarthritis, the problem starts with drying up of the joints. So hyaluronic acid is a substitute of your normal synovial fluid. And if in any case patient present with advanced arthritis which requires any surgical treatment like arthroscopic treatment or replacement of the joint, we have that facilities in our attached hospital in Moharak. So we are well equipped to deal with all kind of arthritis.
So yes, doctor, I think our viewers watching us with such difficulties can definitely approach Al Hilal Hospital, can approach you at Al Hilal Hospital, Salmabad. And as doctor said, lifestyle is very important for most health diseases. So do stay safe, stay healthy. This is Marina Francis signing off from this week's Health Word episode. We shall meet again next week, Tuesday, same day, same time. Good night.